Good morning and welcome to Breaking Burnout for Nurses podcast. My name is Bonnie Kitahata and I'm glad to have you here. So sometimes with burnout for nurses, sometimes we just need to get into another unit, try another type of nursing. And so today we're going to be talking with Colleen Edgington, and she's going to be telling us about her prison nursing experience. Good morning.
Good morning, Bonnie. Thank you for having me. It's good to be here.
Thank you. And so just tell us a little bit about yourself first, kind of like where you started in nursing and a little bit about your pathway to prison nursing.
Well, I wanted to be a nurse since I was about 14 years old. And the human body is such an exquisite machine, much more complex and much more beautiful than any machine that we see, like a vehicle, for instance. And I've also wanted to help people. So it was a good choice for me. And I graduated from Wayne State University in 1995, and I have worked ever since then as a registered nurse. And it's been a very interesting ride, to say the least.
Well, what were some of the different units that you've worked in?
Okay, so I started my nursing career on a med-surg unit. So maybe like a basic generic kind of nursing unit. And I went there to telemetry where we evaluate people's cardiac rhythms. And then I just kind of stepped up. So then I went to intermediate care where patients are a little sicker and they might need some drips and their care becomes a little bit more complex. And then I went up to ICU, and I would sometimes, work, a shift or two in coronary care unit, CCU. And then I also did critical care transport where patients will need, a critical care nurse during transport. So I did that for a little bit. And then I wanted something different. Than the bedside, because it can be so draining to be taking intensive care of somebody or two people in some cases for 12 hours at a time. So I went and I would transition over to like doing pre-op where you can work 8 hours a day instead of 12, and doing recovery room nursing where you still use your skills and your knowledge from critical care to provide care for the post-operative patient. So, it all just links together. And so I did pre-op, I did the PACU, then I've always gone back to med-surg tele. And then I made a big change in my life. And that was, I decided that I think I could live better in my home state of Michigan than I could in California. I had lived out in California for over 20 years. And there was just something that just seemed to be amiss. And I just wasn't quite sure what it was. And then I realized that there were times when I really missed my family. And I could no longer work more to make more money to live at the standard that I wanted to live at in California.
I totally understand that, being in California, right?
Pretty expensive.
So now, how did you get to prison nursing? Did you say, I want to be a prison nurse? Or how did that opportunity come up for you?
Years earlier, I think I had been reading in a nursing journal, and somebody had remarked that they worked in a prison and that it wasn't too difficult. And actually that the inmates were pretty good to the nurses. So I'm like, okay, well, that sounds interesting. I'll just kind of bookmark that in the back of my mind. And then when I came back to Michigan, I'm like, I really need a change. So I was looking for jobs, and then this job came up for working in a state prison. And as it would be, I was very fortunate. The prison was only like 10, 15 minutes away from my home. And it was on a contract basis. And it was a great job. I really enjoyed it.
So for some reason, to me, and I'm sure this is totally wrong, but it makes me nervous to think about working with inmates, thinking that they're criminals and they've done, terrible things. So, so what type of crimes were they in there for?
Oh, they were in prison for anything, a robbery, rape, murder, sexually based offenses, drug dealing, all kinds of things. But they were for bad things. I really didn't think a lot about why they were there, and it didn't really seem to bother me, which was good because that allowed me to kind of do my job without looking at them and thinking, oh, well, you're a murderer. So,
I'd want to ask them, without, if I could get to the point where I feel comfortable enough to ask them about, like, hey, why are you in here? And, you hear on TV in those shows, like, that they never tell the truth of what happened. But I'd really be interested to learn about what crime they committed and, how they got into all that. But anyway, so about how many patients did you work with at a time? Was there like a staffing parameter of how many prisoners that you took care of at one time?
This working in the prison is like institutional nursing, as opposed to hospital nursing, where you are assigned a certain number of patients to provide care for. So the day would usually start as the inmates that are diabetics would come into healthcare, and we would test their blood sugar, and we would give them their prescribed dose of insulin. Okay, so that's one of the roles that you play when you're in prison. And then people also take, routine medications because they have, certain health conditions that need to be medicated. And so we have medlines. So I wouldn't give meds to 6 patients. I give medlines to like over 200 or 300 people. They all just come in a line and they have to begin with their medications. And on the computer screen, it'll tell you which medications are due. And then you pop out those medications. You give them to the inmate, and then you watch them take their medications. You can't just, look away because noncompliance is a big problem. So you have to do a mouth check, and you also observe them while they're taking their medications, because sometimes they'll try to pocket it in the middle, on the back of their mouth, and you're like, no, you're going to take your medications.
So they come like to your office, or they come to you for their medications. You don't go out to them and deliver one to each. Are they in a cell or
so in their housing units? They obviously are housed in cells, but they have the freedom during assigned times for med pass. They come to healthcare for their medications. And sometimes the nurse will go out to the housing unit. Certain housing units, they have the nurse go out there to administer medications.
Oh, okay. Mm-hmm. So, so you worked there for a limited amount of time. It was a contract, you said, right? So about how long did you work there?
22 months.
Oh, 22 months. That's a long time.
It is. It's not for everybody. I saw many people come and go in a very short period of time. Now, some of them might have just been not comfortable working in a prison, or, maybe they just couldn't adapt to the new way of delivering care. Maybe they were just so accustomed to working at a hospital.
Right.
It's just not for everybody.
Mm-hmm. So like we were mentioning before, were you ever afraid of them? Like, did they ever get aggressive with you, or did you ever have to kind of put them in their place and say, back off or something like that?
So actually, for the most part, when inmates would come, they would always come to healthcare because they had an appointment. And in that unit, there is an officer, and the officer pats them down before they come into the nurses station. So these inmates are getting patted down all the time, and they're looking, for any kind of contraband or a weapon. So I didn't really feel unsafe.
Okay.
One should always be aware of your surroundings. And I would always talk to them respectfully, but because everybody deserves to be talked to with respect.
Yes.
But you don't want to go into the prison working as a nurse telling these guys what kind of dirtbags they are. You don't want to test that boundaries to their behavior. Right? Generally speaking, I would say that the prison inmate is kind of like a low functioning person because here they are resorting to crime, having very little regard for human life and how their behavior has a negative consequence on somebody else.
So about how long were they in there for, would you say?
There were inmates that were going to be sentenced for a couple of years to life.
So is that was that like what do you call like a medium security or I don't know what the words are, but like medium threat?
The housing units actually have different designations. Our level 2 inmates were not as volatile. I mean, they can be, but generally speaking, they're not as high risk for violence or volatile activity as your level 4 inmates. And then we also had level 5 inmates. And there's different factors that go into that. Like, for instance, if somebody has a mental illness, they're at a higher risk of lashing out because of their mental illness.
So so for the mental ill patients, I call them patients, but I guess they're inmate patients. Did they have more security around you for when you were dealing with them? I mean, you definitely felt secure and safe when you were dealing with these.
Yes, because
they were all men.
Yes, it was an all men's prison, and I never saw a patient or an inmate rather in the level 5 area without the presence of an officer. The officer stayed in the examination room at all times.
Well, okay, so that was 22 months, and now that is over. Would you ever consider going back to that job, or was that enough?
That's a good question. I don't know. I don't rule it out. But I think that there's other opportunities in nursing, and I would like to try those as well.
Yeah. What are you looking into now?
Well, I just recently started a contract job at a local hospital here, and I'm going to see if there's opportunities there that I could explore.
Okay. Well, there's always something more. That's one of the great things that we love about nursing, right? Because there's so many variations that we can try.
Absolutely. If there's not like 100 different things that you can do in nursing, then there's simply just nothing that you can do in nursing. But we know that's the case. We know that you can work part-time or full-time, or you work as little as you want. You can work as much as you want. You can take care of incredibly sick people if that's what your goal and desire is, if that's what drives you. Or you can take care of just providing routine care for relatively healthy people. There's just different things that you can do with nursing. So it's really nice to have that.
Another thing that is possible is travel nursing, which I'm going to be interviewing one of my friends who's been a travel nurse for many years. So we'll look forward to that. But anyway, Colleen, the time has gone fast as usual. And so anyway, so I just want to thank you for being on the podcast. And I invite you back for another show, if you will.
I would love to be back. Thank you so much, Bonnie, for having me.
Great. And so that's the end of this show. And so looking forward to next Monday at 10 o'clock a.m.
Okay. Thank you, Bonnie.
Bye.
Take care. Bye-bye now.
Bye-bye.